Hello and welcome to this video. My name is Kris, I'm an Australian GP, and welcome back to my Health Condition 101 series. Today we're going to be talking about cervical cancer. What is it? How do we screen for it? How do we prevent it? Types, treatments, and so on. So if you're interested, please keep watching. So the term cervical cancer actually encompasses several different types of cancers, which we will dive into in a little bit of detail later. Cancer, of course, is the condition in which a cell's DNA is damaged and unable to complete the cell cycle. So in a normal cell cycle, cells are formed, they have function, and then they die off and new cells replace them. But in cancer, that doesn't happen. So these cells grow abnormally without normal function and can form masses, which then is known as cancer. The vast majority of cervical cancers are caused by a virus known as the human papillomavirus, or HPV. HPV is actually a really common virus with several hundreds of subtypes, and it commonly causes warts, both genital and non-genital warts, that is. That being said, there is a small proportion of cervical cancers that occur with no viral predecessor. It's just an abnormality in the cells without precursor. At some point in their life though, 4 in 5 people will have been exposed to HPV at some point. So it's really, really common. There are 2 main strains of HPV that are known to cause cervical cancer, HPV 16 and 18, and thus we screen for these when we do our pap smears, which are now known in Australia as the cervical screening test. As with all cancers, there are some risk factors for cervical cancer outside of HPV, including smoking, excess alcohol intake, having an immunocompromise because of something like HIV, for example, and having a family history of cervical cancer or similar cancers. There are 2 main types of cervical cancers, the squamous cell and the adenocarcinoma. With squamous cell carcinoma, there are 2 precursors, I suppose is one way to say it. You've got L-cell, or low-grade cervical changes in situ, and H-cell, high-grade cervical changes in situ. With L-cell, there is a chance that this can regress on its own and that the body will fight off the abnormal cells and you will not develop a cervical cancer. So at this point, we may discuss just screening and just monitoring. However, depending on you and your history, you may be advised to have treatment in this instance, just like you would with a H-cell or a higher grade lesion. So it's really important to chat to your healthcare team. Squamous cell carcinoma does require treatment, and we will cover that in a little bit shortly. As for adenocarcinoma, it too has a precursor, adenocarcinoma in situ, but because of the aggressive nature of adenocarcinoma, even with the precursor or the lower grade, it is strongly recommended that treatment occur to prevent it becoming an adenocarcinoma. The main difference in adeno versus squamous cell carcinoma is the cell that it begins in, squamous cell being the epithelial or the surface cells, and adenocarcinoma being the glandular cells. Both can be very, very aggressive. In my experience, adenocarcinoma seems to be the more aggressive of the 2 that I've seen. Scarily enough, cervical cancer is silent most of the time, especially in the early stages. Some people can have symptoms, and sadly these symptoms are more common with more progressed disease and more aggressive disease, and they can include bleeding, especially when you don't expect to be bleeding, like a menstrual cycle, bleeding after sex, having a feeling of pressure or pain in the vagina itself, sort of further up along the wall where the cervix is, having a change in your menstrual cycle, so it being a bit heavier or something similar, and sometimes a change in discharge can be an indication of cervical cancer. So let's talk about investigations and start with screening. So a pap smear or a cervical screening test is recommended for those with a cervix from the age of 25. I've done a whole video on how a pap smear is completed, but very, very quickly, a patient is laid on the bed with nothing on from the waist down. We insert a speculum, which is a duck-billed plastic thing covered in lubricant, to insert it into the vagina to open it up to see the cervix at the very end. We then take a very specific brush, which we brush the cervix, take it out, remove the speculum, that's the smear test done, and then we shake off the cells that we've collected on the brush into a very special liquid and send that to the lab. The lab then analyzes this for any signs of 5 main types of HPV and also look at the cells to see if they look abnormal or not. If this is done correctly and there was no issues, then screening tests occur every 5 years. Unless of course you've had an abnormality in the past, in which case you may need more regular tests, but I'll leave that up to you and your GP to discuss. If for any reason you do have abnormalities on your cervical screening test, or you're asking for a test to be done because you've got symptoms, or a doctor suggests you have it done because you've got symptoms, if there is anything abnormal, then you will be sent for what's known as colposcopy, which is a closer look at the cervix, where several types of stains, which are very safe, mind you, are applied to the cervix to see if there are any cell changes grossly visible to the naked eye. And sometimes at colposcopy, biopsies can be done as well. So taking a sample of the cervical tissue to then look under a microscope to determine if there is abnormalities. Treatment, like all cancers, will vary depending on you, the severity of your cancer and the spread, but may include what's known as a LETS or a LEAP procedure, which is where a portion of the cervix is removed with a laser and removes all the abnormal cells. Sometimes further surgery is required, which may include removal of the cervix itself or a hysterectomy, removing the uterus as well as the cervix. Sometimes chemotherapy is advised, as is radiotherapy or radiation therapy. So I just want to touch very quickly on prevention. So there is a vaccine out there which is advised for both boys and girls from the age of 12, known as the Gardasil here in Australia, which protects people who are vaccinated against 7 of the most common cervical cancer or cervical change inducing types of HPV. So there you go, guys. Cervical Cancer 101. If you're interested in what's a smear test and what's involved, I will link that video down below. Otherwise, leave me a like, leave me a comment, what do you want to see next, and subscribe if you haven't already. But until next time, guys, stay safe, stay healthy, and I'll see you in a video very soon. Bye.